and welcome to this week's Cityline. It is wonderful to be zooming from my kitchen into your home or your place of work, wherever it may be. We have a great hour ahead of us. Later on, we'll be talking with Brittany Henderson. She is the director of Disenchanted at Tacoma Musical Playhouse. She'll be here to talk about that show, what it was like to direct it, and how you can attend it and also keep yourself safe from COVID. Girls, Hearts on Fire. Cecily Krosky will be here. She's the founder and president of that organization. She is ripping it up in Tacoma for girls from 5th grade up to 12th grade. So parents and friends, you definitely want to hang out for that. Norman Brickhouse, my friend, my neighbor, a man that I admire and respect. He is the director of mission services for Vallejo. He will be here to talk about the programs that they are rolling out and also sustaining for our family members and also community members who are unhoused. The Humane Society will be here with the Pet of the Week. And with me right now, I have an individual, I think he probably is the hottest ticket in Tacoma right now. Everybody wants to talk with the Tacoma-Pierce County Health Department. And yep, we're going to do it right here. Please join me in welcoming Kwan Woods. You are a COVID-19 response incident commander. My dear, welcome to Cityline.
Thank you for having me, Amanda.
It is great to have you. And like I said, everybody wants a piece of the health department right now because that's right, it's back. It never went away. It just was quiet for a little bit and it came back even stronger. So, Mr. Kwan, let's get to it. As a country, we are as far as COVID cases go, they are still rising. Is that information correct as of this conversation?
Yes, and no. So this past week, we saw a slight increase in outbreak numbers and a steep rise in cases associated with the outbreak. So the number of cases and hospitalizations related to COVID right now are among the highest we've seen since the pandemic began. That said, though, we see some early evidence this wave has peaked now, and the cases will likely level off soon. So we're starting to see a bit of a plateauing there. We expect hospitalizations and deaths will continue to increase in the weeks ahead because they usually lag behind case counts by a couple to 3 weeks or so. So we all need to take care of ourselves and help protect those around us as we've been doing. So vaccination, including booster shots, will help protect people from serious illness and winding up in the hospital or even death. So if you're sick and you've been in contact with someone who has COVID, stay home is the best measure.
Absolutely. So let's clarify, and I think for the next 9 minutes, we're going to be doing a lot of that. Clarifying. Everyone 5 and older is eligible for the vaccine, and everyone 12 and older is eligible for the booster. Is there a charge for these services?
There's many places that you can find, with our website being one of those places, to find locations where you can find vaccination opportunities free of charge. So, but that's right, 5 and older and eligible for vaccine, and everyone 12 and older eligible for a booster. Again, vaccines remain the best defense we have against COVID-19. Our students' mental health and well-being has suffered during this pandemic as well, so we remain committed to keeping our schools open and safe, which is why, again, vaccine our best defense against it, so everyone should. So kids 5 and older are eligible to get vaccinated, and everyone 12 and older to get their booster, so please do.
Oh, couldn't have said it better myself, because that is, let's just get down to straight talk and brass tacks. Vaccination, booster, mask, distance. Do it, and you have a chance that you're keeping yourself and your family as safe as you can be. I recently looked for a booster for my adult daughter, and she lives in Seattle, and it was rough trying to find a booster. And then I kind of came closer to home, and it was still as difficult. So where can we find more information about where we can get both of them? Because now is the time to go do it.
So I would say again, I'd point anyone to our site to find locations especially in our county, especially. So we have plenty of openings for people who want to get their second dose of vaccine or the booster from our static or mobile clinics. We have multiple sites. We have one in Puyallup. We also have one in Lakewood as well. And so you may also be able to find an appointment at your local pharmacy. So don't discount that that's also a location where you can find appointments and be able to go in and get that taken care of. So again, pointing back to our website, find your dose today at tpchd.org/vax-to-the-future.
I love that, absolutely. And also while you're there, sign up for updates, because my phone goes off all the time when updates come through, and I'm always wanting to know the numbers, the levels, all of that, because information is power. So speaking of that, Mr. Powerful, give us some tips on things that we can do to minimize our exposure. And I'm asking that, and people may think, well, gosh, Amanda, we're coming into our third year now. You would think you'd know. But none of us expected Omicron to be what it was. We thought we just got through Delta, and now there's a lot of people who are sick, and we've got a lot of confusing information out there. So set the record. What are some things from the health department that we can still count on?
So the tried and true recommendations still remain our best defense. It's a matter of how we're executing on those defenses. So I would say, our approach to fighting COVID-19, it remains the same. It's important for everyone 5 and older to get vaccinated, which we just talked about, and for those 12 and older to get booster. But always taking the familiar steps, and Amanda, you mentioned it yourself, wearing a mask, keep your physical distance, limit gatherings, right, which we know the holidays just happened, but limiting gatherings, wash your hands, stay home when you're sick, and get tested if you have symptoms, right? Those last two are kind of the tough ones, right? Staying home when you're sick, right? And making sure to get tested to ensure that you're not exposing anyone else to COVID-19 versus maybe just a different respiratory illness, right? But either way, you want to keep everybody around you and not getting sick. So again, these measures stay true. I would say if you're wearing cloth mask, think about ditching the cloth mask and going to the 3-ply surgical mask, or maybe even a KN95 would be an added measure that you can take. Double masking would maybe be another added measure that you can take. So there's some additional things that you can do, but again, those tried and true methods remain our best defenses.
Something that I've noticed about our society now that we are, like I said, in the third year of this, is that when this first hit, we sheltered in place. We adjusted on how we could work from home via what you and I are doing right now on a Zoom platform. But recently, one of my favorite people in the world, Marilise Hood-Kwan from the Center of Dialogue and Resolution, was talking about people working from home, and when they have COVID, to stop working. She's like, people need to rest. It doesn't mean you still work 12 hours. That's only going to prolong and make this virus worse. Am I correct about this?
Hey, we know with any illness, rest is the best therapy, right? Rest, disconnection from all of the normal stimulus that is out there in the world, giving your body an opportunity to rest and recover, right? We know is the best method to get back into the swing of things. So I would say that is a great piece of advice for people to unplug. If they're not feeling well, it's important to get that rest. It's important to get your sleep at night. If you need a nap during the day, take it. Your body is trying to respond to fighting an illness. So respond back to your body in a loving way.
Oh, I love that. Let's talk about testing, and primarily I want to ask you, can you describe to our audience the difference between a rapid test and a PCR test, and if there is a efficacy level in them, what is it, or in terms of how effective they are?
So right now, really the differences are you'll hear the rapid antigen and then you'll hear the PCR. Typically, the differences are is the rapid antigen can return its results a lot faster, right? Within 15, 20 minutes or so, give or take, on either side. Whereas the PCR test, we actually use that as a confirmatory test to the rapid antigen test, which then produces its results about up to 72 hours or so. So you can understand how the rapid antigens might be a little bit more popular just because of the turnaround time to receive your results. But again, the PCRs are our confirmatory tests that we use against those rapid antigens.
So I've been home for a couple of days. I'm making this up, and I'm not feeling good. I took a rapid test that I got at my local pharmacy, and it came out negative. But I'm still feeling awful after 5 days. Is that when I should pick up the phone and find a testing site and get a PCR test done?
I would say you're in your window. There within your 5 days, depending on when your symptoms developed as well, right? Because you're within a couple days on each side with your symptoms and your shedding. So I would say that if you're still feeling poorly, right, and the symptoms are persisting, I would think testing would be a good opportunity. I would also go as far as to say, make sure you contact your medical provider if you have one. Talk to them about how you're feeling and what should be the next steps, right? Because they have the most detailed information on you as a patient and can help you sort through what's the best next step. So I would also encourage folks to touch base with their provider as well about how to manage what they're feeling.
Oh, that's such brilliant advice, because everybody, just like our thumbprint is unique, we are all unique in terms of what we are bringing to that test. If we have an autoimmune compromise, or somebody in our late 80s and we have rheumatoid arthritis, there's so many different things that will affect how we feel or how we are viewing Omicron. So yeah, go back to your healthcare provider who can say, hey, 3 years ago you had this, maybe it's that, but really knows you well. Where should we go to get the most current information on COVID-19, the most up to date?
Well, again, and I'll tout it again. Our website, our website is a place that has an enormous amount of information. But I would beg that anything that you're looking for, you're going to get close to finding it, if not finding it, on our site. And so we have the latest guidance and data on our site. We update case counts Tuesday. Vaccine data we update on Wednesdays, and outbreak data we update on Thursdays. So you can find where to get vaccine or testing, as we mentioned earlier, and we post regularly on your reliable source blog and send it out weekly via bulletin to subscribers. So again, like you mentioned, Amanda, sign up for those updates and it'll come right to you, right where you are, and as an easy way to stay in tune to what's going on.
Absolutely, because we always want to be in the know. Thank you so much for being here today, taking time out of your uber busy schedule. I mean, I'm just imagining that, you're not sleeping a whole lot. You got a sleeping bag wherever you need to go and lots of masks and everything else. So thank you for all that you do for us. Please keep yourself well. And I can't wait to see you again, hopefully with better news. How's that?
That's great. Thank you for having me.